Hi, good morning Carlos. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 22nd of January 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Carlos Steiner.
And what is your candidate number, please?
My candidate number is 240825867.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why do you want to be a nurse?
My goal has always been to find a career that challenges me, while also allowing me to make a difference for the better in other people's lives. Caring for others is one way for me to make that difference. And the diversity and unexpectedness of the nursing profession take care of the challenging part. So, I find that nursing gives me the chance to achieve my career goals.
What are your strengths?
I would say, my biggest strength is my ability to work well under pressure. My 3 years as an emergency room registered nurse have taught me how to manage the stress of the workplace efficiently, how to think clearly, and keep me cool, even when it seems that nothing is going according to plan. Maintaining efficacy, while under stressful conditions, is one of my strongest suits as a nurse.
What are your weaknesses?
Regarding weaknesses, I would mention that I sometimes get wrapped up in caring for my patients and spending so much time with them that I put on second place the job-related administrative tasks. On occasion, I have postponed completing the paperwork as much as I could. But I understand how central to patient care is to have accurate records of the care we provide, so I am doing my best to break this habit. Instead of leaving all the paperwork for the end of the shift, I try to schedule a few minutes throughout the day when I update the paperwork. I had to learn to manage my time and tasks better, but I am a lot more efficient now.
How do you deal with work stress?
I know that stressful situations are bound to arise in nursing. In the emergency department, you never really know what the next moment will bring. That can be pretty taxing. But I think that accepting stress as part of the job allows me to get past it easier. When I find myself in a stressful situation, the first thing I do is take 3 deep breaths. It may seem like little, but it gives me the exact right amount of time to refocus my energy, gather my thoughts, and concentrate all my attention on the task at hand. Stressful situations are less alarming when you tackle them directly.
How did you handle a difficult situation?
Being patient, listening, and communicating well can make a significant difference. One difficult situation in which I found myself was caused by a problematic patient. He was aggressive, raising his voice and getting angry. I learned that only a couple of days ago, he had experienced some severe personal problems. This came at a time when his disease was worsening, and that led to his erratic outbursts. So, I tried to be empathetic and validate his feelings. I understand why you may feel this way. Let me know if there is anything I can do to help make you feel better. Once I connected with him and listened to him, he changed his attitude and became easier to work with.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Well, Mihiraa, I have taken Marshall's blood sample. By the way, Mihiraa, based on my observations, I can provide some information about his condition.
Yes, nurse, I would like to hear about it.
Mihiraa, I am glad to inform you that I found some evidence of progress in his condition. He is having a gradual recovery. His improvement is evident in his mobility, and has also gained strength. Do you have any questions, Mihiraa?
To be open, nurse, I am finding it quite difficult to take care of Marshall. Carers for him come once a day to help with washing and dressing, but except for that, I am doing almost everything else myself.
I truly understand the difficulty you are facing. However, it will be great if you can specify the difficulties you are dealing with, so that I might be able to help you.
Nurse, it is not specific things that are feeling difficult for me. When it just takes everything together, I find it difficult, because I want to do as much as possible.
All right. What I mean is that, if you feel difficulty in certain areas, like the provision of meals, cleaning, shopping, preparing your spouse for bed, etc., then those aspects can be dealt with extra assistance from the respective providers.
Yes, I understand what you said. But I do not feel like mentioning anything in particular.
All right, that is understandable. Well, Mihiraa, I would like to know the impact on you.
I feel tired all the time, as I don't get any time to relax. But that's okay, I just want to make sure that I take good care of my husband.
I know what you mean. Above all, Mihiraa, I wish to know about your health.
So far, I have good health, and that is why I can take care of him well.
In these situations, the carer's mood will be affected seriously. So, how about your mood?
My mood is still okay. Not being affected by this.
Good to hear that you have good health and mood. It is very important to maintain and ensure a carer's well-being. Only then will we be able to identify the carer's ability to continue in the role and how well you cope with the carer's role. It also plays an integral part in a patient's recovery.
Definitely, nurse. I agree with your words.
And Mihiraa, I just want to remind you about the availability of respite care, which means care for a day. In respite care, trained staff will be providing care for a patient in the residential space by doing daily visits. It is available for various periods as well.
Nurse, I understand the benefits of respite care. But, I feel guilty spending time away from my husband, especially when he is in this situation.
Your thoughts are sensible. May I know if you have discussed the respite care with your spouse?
No, I haven't spoken to Marshall about respite care, but he would probably be fine with either, as long as it is only for a short time.
Yes, what you said is correct. It is for a short time. But, as you haven't discussed this with him, let me tell you what you have to do next. First of all, discuss daycare with your spouse, and come to an agreement on the length and type of care he prefers. Accordingly, I can make a referral for the daycare. It also requires the completion of relevant paperwork, that is an application for the same.
Sure, nurse. I will do that. Nurse, your advice has been really helpful. I will talk to my husband about a day, and I will let you know afterwards.
That's perfect. Mihiraa, do I have to address any more concerns?
No, nurse. I am now feeling more informed and supportive.
My pleasure. I wish him a speedy recovery, Mihiraa.
Thank you, nurse. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.